Dr. Arasaratnam is an assistant professor in internal medicine, Division of Infectious Diseases at UT Southwestern Medical Center, and he joined the faculty there in 2017. He is one of UT Southwestern's physician experts on COVID-19 vaccines currently available in the US. He is a graduate of the University of Oxford Medical School in the UK. He's completed his internal medicine residency in England, achieving membership in the Royal College of Physicians in 2010. He subsequently moved to the United States to pursue an internal medicine residency at the University of North Carolina and infectious disease fellowship at Baylor College of Medicine. During his fellowship, he gained additional clinical training in transplant infectious diseases and pursued translational research in T-cell immunotherapy for the treatment of viral infections and immunocompromised recipients. Let's just say he's an expert in this field, and we are very fortunate to have him here today. The floor is yours, sir. Thank you for joining us.
Well, good morning, UT Dallas. It's great to be here. Firstly, I just want to check that everyone can hear me, and also my slides are up. Is that correct? Thank you very much. Well, I appreciate that introduction, but I'm going to put it simply. I'm an infectious disease practitioner trying to stomp out one infection at a time, and a strong believer in vaccines. I have no disclosures for today. I have been really educating and teaching on COVID-19 vaccines since last summer, since before the approval. And so for me personally, it's been remarkable to see the development. And I hope what I have to share here today will be of importance. So I call the COVID-19 Road this past year. It's been a very long and weary road. And I think we're all tired of this road, and we're looking to try and get off this. And vaccines offer our best opportunity to get off this road. And the messages that I want to talk to today are really actually some of the same messages that we have been talking about for the last several months. These include the safety of vaccines, their strong efficacy against protecting, particularly against hospitalization, severe disease and death. The current vaccines we have available, or the Pfizer and Moderna that were approved in December, and then the J&J vaccine that was received emergency use authorization in February as well. And we actually are fortunate that there are probably going to be, in the next couple of months, more vaccines on the way. And this is great news to meet the needs, not just of our population here in the US, but around the world. Now, alongside vaccination, we have had, since the beginning of this pandemic, the ability to stop transmission, and these have been via what we call NPIs, or non-pharmaceutical interventions. Amazing that simple masking, distancing, hand hygiene are very powerful tools in also reducing the transmission of this virus. Now, with all the preparation that's actually gone into delivering vaccines and developing vaccines, unfortunately, there's been a lot of misinformation that has come out there. And so it's very, very important to correct this. It's very important to use trusted sources, such as the CDC. I often point people to the CDC, I point physicians, I point patients to the CDC, because it has excellent resources about understanding these vaccines, written in easy to understand language. And, it's surprising to me that even several months into this vaccination process, we've had issues with, the false information that's been spreading. So, COVID-19 vaccines do not give you COVID-19. They do not cause infertility. They do not cause false positive tests from the nasal swabs, right? And so these are sort of things that have been spread and propagated that have prevented vaccine uptake. It's very important to get the information from the right place. Now, I understand it can be very, very confusing. You have all these different types of vaccines, and you read about this and you're like, well, this one is an mRNA vaccine and this one's a viral vector vaccine. But let me put it to you simply. Vaccines are basically teachers of the immune system. And what they're doing is basically teaching your immune system to recognize the virus and prepare in advance so that if you are exposed, you'll actually be ready to fight the infection. So if you look all the way on the right, the inactivated virus, one way we can make a vaccine is just taking the whole virus and weakening it and delivering it. That's one way. But another way is just to take a small part of the virus, like a protein part of that virus, just a small protein, and I use that as a vaccine. And what we actually have started with is very, very, very far over to the left, these RNA vaccines. And what these are doing is essentially just giving the blueprint for your own body to make the protein and make the immune response. So your own body is actually making the vaccines. Now, when I've talked about vaccines and COVID-19 vaccines, a lot of people have been raised the issue to say, hey, you know what, these vaccines were developed so fast. You know, usually it takes several years to get a vaccine. How did we get here so fast? Can I trust them? And it's very actually important to understand. And what I teach people is that this is not a 1-year process. Think of this as actually a 30-year process. Because it was actually back in the 1990s that we started looking at mRNA as a possible vaccine technology. Like any new technology, it needs to be worked on, it needs to be refined to actually be able to be used in humans safely and effectively. But that work started 30 years ago. And then the other thing that was very important is we were able to learn from what I call the brothers and sisters of SARS-CoV-2. So SARS-CoV-1 and MERS were coronaviruses, thankfully did not end up like the pandemic that we have today. But because of their arrival, we actually started understanding what our immune response were to these viruses and how to make a vaccine. And then the other thing that is really important is that there was a huge amount of financial investment, particularly after 9/11, understanding that the potential of biothreats and bioterrorism, we actually needed to be prepared with vaccine platforms that were rapidly switchable and versatile. And so a huge amount of money was actually poured in, particularly developing and looking at the mRNA technology and the viral vector technology. And that's not the only thing, because I think there is this perception that clinical trials took shortcuts. And that is not the case. When we do a clinical trial for the vaccine, we begin with initial studies in animals, models to look at safety and effectiveness in preclinical, and then moving on to phase 1, which is just dose testing in a population, phase 2, and then phase 3, which is your acid test, a large randomized control trial to actually see whether your vaccine will protect you from disease. And vaccine development is a very economically risky process. So typically what would happen is you would wait till in between those stages, wait to see what the final results are. And only after then, invest in the next phase. And then you'd wait after phase 2, and then only then begin planning all your infrastructure for phase 3. And only after that happens, will you actually get the results of phase 3, get your approval, and then you begin manufacturing. But what happened in COVID-19 vaccine development was different. There was a huge amount of money poured in to say, hey, you know what, we're going to take a risk, not on the risk of participants or safety in vaccines, not on the risk of scientific integrity, but we're going to risk dollars. We're going to invest ahead in this vaccine before we know it's going to work. The risk is that we may waste millions of dollars, millions of vials on a vaccine doesn't work, but that was a risk we were prepared to take given this global threat. And what does that allow? Well, actually what that allows you to do is to do overlapping phases and manufacture in parallel. And so by the time in December we actually had emergency use authorization for this vaccine, we were actually able to start distributing and we didn't have a delay period. Now, one of the common questions is, how do these mRNA vaccines work? I don't understand the mechanism, and it's very important. I use this schematic to illustrate. Essentially, what you're doing with an mRNA vaccine, and so this is with Pfizer and Moderna, is you're giving the blueprint for your own body to make the vaccine. And so what happens is that the mRNA is sort of packaged in a fatty coat, a lipid coat, gets into your cells, and then your cells makes a key protein, the spike protein. And then your own immune system generates a response to that spike protein so that you are protected. Importantly, you only are coding for one protein of this virus. So you're not coding for the whole virus. There's no live components in this. There's no risk of getting COVID-19, and it doesn't mess with your genes. It does not alter your genes. Now, the viral vector vaccines, the J&J vaccines that you may have heard about, received emergency use authorization in February. It's a very similar process, except instead of delivering that blueprint in a fatty coat, you're actually using a virus, a viral shell that cannot replicate a very common virus called adenovirus. Adenovirus causes common colds. And so what you're actually using is you're taking the shell of that virus, you've gutted it out completely, and you're putting the blueprint inside for that spike protein. So what happens is the viral shell is like just a delivery vehicle into your cells so that you can actually make the protein and generate the immune response. Now remember, this viral shell that goes into your body doesn't replicate, so it's not going to spread anywhere. All it is like a delivery shuttle. Now, when we look at these first two vaccines that came, it's astonishingly effective, both over 90% effective. And remember, I think people forget that way back in June, the FDA set a benchmark for effectiveness of COVID-19 vaccines. The benchmark was 50%. And both of these vaccines, coming from different companies but using similar constructs, were able to actually both achieve over 90% effectiveness. That is incredible. That is more than we ever would have hoped for. Now, many people are concerned about side effects, and it's just important to realize that side effects of a vaccine are essentially the evidence that your body is making an immune response to this vaccine. And so it's not really something to be alarmed about. When you actually look at these COVID-19 vaccines compared to other vaccines that are approved and we've been using for several years. So take a look at Shingrix on the very far left. This is a vaccine to prevent shingles, or zoster. It's licensed for those over 50 years of age. And actually, when you look at a term we call reactogenicity, that are sort of the side effects that you get from these vaccines, it's actually very similar, if not more, to the mRNA vaccines. So really, these side effects are comparable to other vaccines that we have licensed. What about, effectiveness of all these different vaccines? Because I hear different numbers. Moderna, Pfizer, we're over 90%, and I hear 66% from J&J. I hear different things about the AZ vaccine that might be coming out. Well, it's important to realize that the effectiveness of vaccine is not just contained within one number. Because we look at effectiveness to prevent mild infection. We look at effectiveness to prevent severe infection. We look at effectiveness to prevent hospitalization. And highlighted here in the middle two columns on the left, in yellow, are really the essence of these vaccines, that they all provide incredible protection from hospitalization and from severe COVID-19. That means that really, yes, people get worried about these different numbers, but these are vaccines that will save your life. That's the bottom line. Regardless of what type they have protection against hospitalization and death. Early on, after the rollout of the mRNA vaccines, there was this concern about allergies, and again, this I think created some delay. These have actually now been really very carefully studied by the CDC and by post-monitoring systems. And so there's very careful checks in place to address this allergy question. Now, it's really important that really the only absolute contraindication to a COVID-19 vaccine is if you have had an allergy to that vaccine or to one of its components. And you say, well, how do I know whether I am allergic to one of its components? Well, PEG, or polyethylene glycol, is very common in a lot of gels. It's used in bowel preparations. Most likely you would know if you're allergic to this. But again, the CDC has very clear guidance on this. What I want to iterate is that allergies such as food allergies, you're allergic to cats, or you're allergic to, oral medicines, you are eligible to get this vaccine. Okay, you do not have to be concerned about this. This is the only contraindication is if you actually have an allergy to the COVID-19 vaccine. Now, when it comes to safety, I want to iterate this. There is ongoing safety monitoring now that these vaccines are being rolled out. I want to iterate that it didn't just stop with these phase 3 trials and then the approval. As we speak, there are ongoing monitoring of side effects that's being fed back, and it's been fed back through a lot of different mechanisms. One of these mechanisms that you can voluntarily sign up for after you have your vaccine is called vSafe. It's a great app. I used it. And what it actually does is it sends you text messages after you get your vaccine doses. Usually it's daily for the first 2 weeks, and then it spreads to weekly intervals. And what you can do is it can allow you to report side effects. And if there's any of those that are actually very, very severe or concerning, it will actually prompt a phone call to explore this further. And it also, provides a nice reminder for your second dose. So, how are we going to get to protection? How are we going to get back to some near normalization of this, of our communities? And I want to iterate that these things we do are not just to protect ourselves, they're to protect our colleagues. Our MPIs, our vaccination, it's not just about protecting ourselves, it's about protecting our loved ones, it's about protecting our work colleagues, it's about protecting our community. It's a big call. It's a call that, that really the measures we take, and when we undergo vaccination, it is really a big statement that we're collectively going to overcome this pandemic together. UT Southwestern has a number of very good resources, a lot of issues about frequently asked questions that are really addressed, and I would encourage you, these slides will be available to actually check these out. And there's a lot of blogs that have also been written, including some of the myths that are put about COVID-19 vaccines, how we can overcome the mistrust regarding this. And I would also encourage you to take a look at these very sort of short video pieces, particularly the Life After Vaccination by my colleague, Dr. Cottrell, because the really encouraging thing coming about these vaccines is their ability to really prevent infections and actually allow people, certainly in private homes who have been vaccinated, to be together. And CDC has actually released guidance on this. And so, yes, we are keeping up the masks and the MPI, certainly at our institution, and that's really a collective responsibility, recognizing as an institution we have a lot of people here, we have a lot of people still to be vaccinated, but we're getting there. If we really do take vaccination and get vaccine, this is going to speed things up and allow our communities to come back together. I also want to point out that there are some helpful videos that have been done in different languages to explain COVID-19 vaccines and the value of the non-pharmaceutical interventions, and these may be helpful for yourself or your colleagues. So I want to thank you very much for allowing me the time today. It's been great, and I would be happily welcome questions.
Thank you, Dr. Arasaratnam. Great information, easy to understand, which I greatly appreciate. We actually do have a lot of questions that have come in. We've got about 10 minutes for questions, so let me just dive right in. So one of the questions is, are there any medical conditions in which getting the COVID vaccine is not recommended?
Yeah, that's a really great question. So the bottom line is that from a safety standpoint, the only contraindication to getting these COVID-19 vaccines are if you have had a allergic reaction, severe allergic reaction to these COVID-19 vaccines. But I want to iterate this. So other than that, the safety of these, it's applicable in many populations. So for example, I want to iterate that these trials had patients with hypertension, diabetes, heart failure, a lot of comorbidities, and these patients were enrolled in the trials. Now, there were some groups of patients or participants that weren't enrolled. People like solid organ bone marrow transplants, or if you got a solid organ transplant recipient, or if you had an autoimmune condition or a rheumatologic condition. But because these vaccines are so safe and we've seen the benefit of these, vaccination is still recommended for all of those groups. And if you have a particular condition, you know, what I would recommend is that there are actually guidelines being developed very nicely for these groups. But in essence, the message is the same. You should get vaccinated. Now, there sometimes might be some nuances as to regards to timing of vaccination. So, for example, you might be a patient with cancer who's undergoing chemotherapy. And in that case, what might happen is that your oncologist or your cancer doctor might say, yes, you should get the vaccination, but I'd rather you'd wait until this point. So the bottom line is that there is pretty much a universal vaccination recommendation for all. I would say that even if you're considering pregnancy or are pregnant, you should look at the very strong guidance from the American College of Obstetrics and Gynecology, Society of Maternal Fetal Medicine, that really do encourage vaccination as a shared decision process with your provider. So the bottom line is the only contraindication really should be if you have had an allergy, severe allergy to the vaccine or one of its components.
Okay, thank you. And that kind of leads to the next question we had about the effects of the vaccine on women of childbearing age. Have there been studies with that? Are there any concerns that they should have? And also, why is it still listed as experimental?
Yes, so firstly, I think there was, you know, the obstetrics and gynecology community advocated very strongly for inclusion of women in these phase 3 trials. And, you know, unfortunately, you know, I think really due to concern for litigation reasons and other reasons, these weren't included. But the bottom line is we now have a huge amount of accumulative evidence to show safety of COVID-19 vaccines in pregnancy and those considering to be pregnant. Let me phrase that by also saying that there've been some multi-center studies looking at the, you know, risk of COVID-19 in pregnancy, and certainly for pregnant women who are admitted to hospital, you know, the risk of ending up in the ICU or even death is higher than the average person. And so this is an important population. What do we have as evidence? Well, actually, we have evidence from the trials. Even though pregnant women were planned to be excluded during the enrollment of the trial, there were women who got pregnant. These women are being followed. And so far, we've not seen any concerning data about the impact of vaccines on fertility or on pregnancy. We have animal model studies that are often done as part of this now from Pfizer and Moderna that has not shown what we call any reproductive toxicity. But I'll tell you the biggest and most reassuring thing is through that VSafe app and through the monitoring. Remember I said that it's not just that people just wash their hands after the vaccine's delivered, it's people are actively monitoring. You know, we've had thousands upon thousands of pregnancies or people who have got pregnant while on the COVID-19 vaccine. And, you know, through the VSafe app, these people are being invited to enroll in registries. These people are being, these women are being followed up and very much, you know, accumulating safety. And so, you know, I want to sort of also reframe the questions about hesitancy of vaccines, and just take this opportunity just to speak to the UT Dallas audience. When you're making a decision about the vaccine, and it is your decision, it's your personal decision, but I want you to understand what that decision is. The decision is not to avoid the vaccine or whether to get the vaccine and its associated side effects. The decision is actually whether to get the COVID-19 vaccine or risk getting COVID-19, which is a life-threatening illness. And that's really how the decision needs to be framed, because I think everyone's focused on side effects versus no side effects. I will say that giving this talk now, 3 months down the line, with the millions of people who have gotten vaccines, is much easier with all this data behind, and you can find this on the CDC, compared to when it was in December and we were rolling it out. I will say even in December when we were rolling out, the approval of these vaccines was based on 30,000 people trials. That's comparable or exceeding what we would do for other vaccines that have been licensed.
Great information. We have a lot of questions, but those of you who have sent in questions, many of those were answered in his presentation. So I'm with the limited time, I'm going to focus on the ones that were not specifically answered. And just a reminder, you can log on and view this presentation again through the HR Campus Connection. You can log on at home and have your family watch it with you if you'd like. So it will be up there, a lot of great information to listen to it again. So one of the questions that was not specifically addressed is, do you expect that we'll have to receive boosters at least once a year in order to stay protected?
Yeah, thank you for this question, and I get asked this a lot. There are a lot of studies actually showing, you know, that really based on the studies looking at how our immune responses are to this virus, that actually we could expect immunity for a very long time, months or even years. And I think that the issue of boosters will probably come up for two groups in particular, or two scenarios. One is if you are what we call immunocompromised, where your immune system doesn't necessarily mount as good a response. It is possible that in the future there will be data to show that a booster is needed. Okay, that's studies kind of are ongoing and trying to understand this. And then the other thing is about the variants, because thankfully, I mentioned about how these vaccines are able to protect against severe death, hospitalization. That actually holds true really for the variants too. But if we allow this pandemic to go, if we don't get it under control, if we don't put in all those measures and get vaccinated, you know, if there are variants that develop, we may need slight switches in the vaccine, you know, in the future as a booster. I will say for the foreseeable, you know, how does that impact what we do now? It shouldn't change. We should get vaccinated and actually be very confident that the immune responses and the protection will actually last a very long time.
Thank you. We have time for just a couple more questions. There's several that have come in about people being concerned for their children. What can you tell us about the vaccine and availability, efficacy for children under the age of 18?
Yeah, thank you for that question. So like there were some excluded groups from the phase 3 trials, children were also excluded. And the reason is, you know, you have different size kids, you're going to have to do different doses of vaccines. There's encouragingly a lot of trials that are underway, both for Moderna, Pfizer, and J&J as well, I believe. And so these are sort of ongoing. Now, what I expect is, you know, I'm very hopeful that by the summer we actually may have some data. And you know, so what would actually happen is, say, if Pfizer or Moderna are actually able to show data, they would actually ask the FDA, that's the authorizing, you know, government entity for these vaccines, to sort of amend their protocol to reduce the age, you know, maybe with a different dose of vaccine. So I will say that we are fortunate that children can still get infected. They can still have, you know, rarely they can have severe symptoms, but thankfully they seem to be less susceptible than the adult population. That being said, we are still strongly advocating and hoping for a vaccine for them, because this is very important as we think about our school years, as we think about our families. So I'm hoping by the summer we will have more data that will actually allow children to be vaccinated. But in the meantime, we just have to do our part and get vaccinated ourselves.
And the last question is a combination of several questions that have come in about the mutants, mutant variations, and questions about will these vaccines address the mutant variations? Can we expect more variations, and so on? So what can you share with us about that?
Yeah, so this virus, like many other viruses, part of as it spreads and evolves, these mutations actually will occur. And many of these mutations won't actually be of significance. We've had mutations of this virus since the beginning of pandemic, since last year. What got people interested, certainly starting off with the variant discovered in the United Kingdom, were that there were a cluster of these mutations in the spike protein. And the spike protein is kind of like the key to the lock of the house, right? That opens the door. That's kind of the way I see it. That's what allows the virus to bind to the cells. Now, what has been very reassuring is, firstly, that certainly for the variants that are dominant here in the United States that might be coming up, that certainly lab studies have shown that the vaccine produces good levels of antibodies. The clinical studies that are ongoing in different places, South Africa, England, with the newer vaccines, have shown that for severe death and hospitalization and protecting from severe disease, these vaccines are still great. And one of the things I would sort of say is that, you might read press releases about, different antibody levels not being produced to these variants, but the immune system is very complex. There's a whole nother arm of the immune system, which I didn't put in my presentation, called T cells. And, these T cells are kind of like the backup to antibodies. And what is really encouraging from all the scientific data so far is this part of the immune system really seems to recognize all those variants very, very well. And so, my feeling is that these variants should not impact your decision to to defer vaccinations. Get vaccinated now. And the other thing is, what do we do about these variants? Well, the longer we allow this virus to spread from person to person, the longer we allow more people to get infected, well, that's going to increase our chance of variants. And so every single thing that we do today, vaccination, masking, distancing, every single thing we do today is going to have a huge impact on the future with regards to variants. And so, my encouragement to you all today would be to get vaccinated. It's safe, it's effective. You're going to do it for you, you're going to do it for your family, you're going to do it for your community, you're going to do it for our nation. And, a bigger focus, which I haven't been put on this presentation, is to think about the world. And we are, I can't even tell you, when I look at some of the other countries and how they're going with COVID, we are in an incredibly privileged position with our vaccines here. And there are several countries around the world that do not have this privilege of vaccination that we have today. And we need to keep that in mind.
Thank you so much, Dr. Arasaratnam. Really appreciate it. We received several comments about how wonderful your presentation was, very informative and very helpful, and how much people really appreciated it. And a separate comment thanking you for your work with the VA. So thank you so much for being here today. Again, a reminder to people, we're going to post this on the HR Campus Connection. I encourage you to go back and listen to it again. Many of the questions that have come in, again, were answered in his presentation. And some of the questions were about, the CDC, and he has listed numerous resources for us to go back and learn more and get more information from. And so I really encourage you to go back and seek out those resources. So again, thank you so much. We really appreciate you being here today.
It's a real pleasure, and I wish you all a very safe, rest of the week. And it's a real pleasure to be here. And I think we're all hoping that 2021 will be a different year. And I hope for you and your families it is.
Well, thank you. Raphael, did you have a comment?
I did. I just wanted to add, good morning comments. I just wanted to add my thanks to Dr. Arasaratnam. And also point out that he will be participating in a panel that I will be moderating on April the 27th from noon to 1 We'll post that information in the HR Campus Connection, and is also up on the Comet calendar or on the Office of Research website. So if you know of other folks that would like to hear more, or if you yourself would like to hear more from Dr. Arasaratnam and another colleague of his from UT Southwestern, please tune in on April 27th to that forum.
Thank you, Dr. Martin. And just a reminder that UT Dallas is partnering with UT Southwestern and hosting a public immunization clinic here on campus in the Davis and Gunday Alumni Center. And so we certainly need volunteers to continue to help out with that. So the link is there. We are putting through somewhere between around 1,000 people a day going through that. It actually doesn't take much time at all, considering the number of people. UT Southwestern has this worked out very, very smoothly. And so if you haven't received your vaccine there and you're looking for a place, really encourage you to sign up. And I appreciate everyone being here. Have a great day, everyone, and see you next month. Bye.